Hi everyone. So this is my language and cultural contact presentation. I recorded this once and I went over 5 minutes, so I'm gonna try and go ahead and go through this fast. All right. My name is Karishma, and I hope you enjoy. So how did I spend my time on this presentation? I scribe in a hospital, and so I see patients. Some of them are Spanish speakers, and so I spent about 2 hours with two patients who are Spanish speakers, and was in the room with the translator. And then the next 2 hours I spent on the CDC website on a more taboo subject, sexual health. A lot of people don't like to talk about it, but it's very important in every language because every human is the same. So I specifically picked this one to see how similar each page would be. And I specifically focused on the STDs, chlamydia, and gonorrhea. So for my hospital interpretations, I obviously, most of us are taking this class because we want to go into healthcare. So we're very familiar with the concept of HIPAA, I'm assuming. And I have everyone named as Doe. So my first patient was baby boy Doe, and then the second one was Jane Doe. And I picked these two to focus on because baby boy Doe came from Mexico with his family and was going to be tested for meningitis, which is common but not super common apparently in Mexico since his family didn't really know what it was. Jane Doe came in because she had abdominal pain, which is very, very common for most people here. So I picked those two to focus on. The vocabulary that was used for baby boy Doe was análisis de sangre, recuento de glóbulos blancos, recuento de glóbulos rojos, cholesterol, and meningitis. So I picked these because his family actually came in with lab work, and it was titled blood work, and it had everything on it. I thought it was interesting that recuento de globulos was common just because it was blood cell count. And then blancos and rojos were easy to figure out since we know that blanco means white and rojo means red. Then we had two cognates, cholesterol and meningitis. So those were easy to count as well. It was also interesting that they tested a baby's cholesterol level. So they test everything, and these were vocabulary words that stuck out to me. For Jane Doe, hers were more common, vomitos, nausea, diarrhea, and then dolor de cabeza, dolor pélvico, dolor de sinusitis. So pelvico, sinusitis, diarrhea, nausea, and vomitos were all cognates in my opinion. Dolor de cabeza is head pain, which we know cabeza from one of our dialogues. Dolor pélvico was pelvic pain, and then dolor de sinusitis was sinus pain. Dolor de and dolor is pain, so those were easy to figure out while listening once I realized that that's what the interpreter was translating. And with these patients, it's very common for most people, and what I was trying to do is to watch them while they speak to us because it's easy to kind of understand things if you're looking at gestures. I'm very used to the questions that are asked when people have pelvic pain, or abdominal pain in general. I'm sorry. So it's the language and the gestures were very similar. Cultural nuances that I found from here. The paperwork from Mexico for baby boy Doe was very messy and unorganized. I'm not sure if it was just specifically from the hospital, but even the translator had a very, very difficult time trying to figure out what the heck was on the paper. And it was hard for the family to understand what was going on with the baby, which leads me to the second cultural nuance of understanding what meningitis was. This is a very common disease and common illness that we have in America, and so for us, meningitis is just something to look out for, whereas for his family from Mexico, they didn't know what it was. And that made it really hard for us to understand exactly what was going on, what they wanted. And after almost 20 minutes in a room, which is very uncommon in the ER, we finally kind of got some understanding, and it was easier to work out. Something in common for both of them were the patient with abdominal pain and the baby boy's family was that they were more comfortable with the Spanish translator. Even though they knew who the doctor was and they knew who I was, they seemed more gracious and more comfortable with the Spanish translator, probably because they were able to communicate with them and not with us directly. So those were the two common cultural nuances for the hospital. So for going on the CDC site, like I said, I focused on chlamydia and gonorrhea. Chlamydia had a cognate of chlamydia, which is what is translated in Spanish. Some vocabulary that we had was infección, embarazo, ectopia, enfermedad inflamatoria pelvica. So infección was a cognate, which is why I picked it, because it means infection. We learned embarazada, which means pregnant, and ectopico is actually a cognate as well. I'm not sure if many of you know what ectopic pregnancy is. Basically, it's a pregnancy out of the uterus. This is one of the medical terms I know from my work, so I was able to understand what that meant and able to understand that translation. What I found was interesting and what I purposefully picked was enfermedad inflamatoria pelvica. Its acronym is EIP, which is which is basically PID in English, pelvic inflammatory disease. I picked this on purpose because, if we did not know, someone did not know what in Spanish or English, and they were just, glimpsing at a page or glancing at the page, they would probably not catch that similarity, which is very, very interesting to me. It's the exact same disease, but a completely different acronym. I thought that was very interesting. The nuances here were the advertisement itself. For the English page, you had people portrayed in different ethnicities, races, and in the Spanish one, there was only people of the Hispanic ethnicity, or population on the page. Everybody was Hispanic, which was interesting. They also had different translated pages in other languages, and I didn't check those, but I'm assuming that those were probably also more centered towards the demographic that was reading them. The contact numbers were also less for the Spanish page. There was about 4 maybe on the English page, whereas there was only 2 for the Spanish, and there was a website included for the English page and not one on the Spanish page. There was more phone numbers there. I'm assuming probably more translating ones. And then this was the most interesting to me. The heading was different on the English page. On the English page, it literally said, women under 25 and older women with risk factors get tested every year. They didn't have that on the Spanish page. I don't know why. They didn't have that anywhere on the Spanish page. I think that's kind of sketchy a little bit, to be honest. That's the same, I'm assuming, for every population, or it could be different for the Hispanic population. I'm not sure. Maybe demographics makes a difference in who gets chlamydia, and maybe that's why they didn't say that. But this is a more contracted disease, so it should not have been that way, not necessarily genetic. For gonorrhea, gonorrhea was also a cognate, which is why it was more easy to understand what it was. Here, I picked similar vocabulary. Latex was a cognate for latex. And then I don't think the word discharge is used in Spanish language. It's more secreciones, which is secretions, which is technically the same thing as discharge, but they don't use that word discharge. And again, the acronym for AIDS was different, I saw, because, gonorrhea can lead to AIDS, or they were discussing basically AIDS in that article. And SIDA was what they had, so Síndrome de Inmunodeficiencia Adquirida. And this was interesting because, again, if someone would just glance at the gonorrhea page, they probably would not know what AIDS was or SIDA was. Probably easier to know than the one that I had previously, the EIP and PID, because the letters here were just reorganized. The nuances, again, were the advertisements. They, again, had people of the same demographic, more Hispanic people, whereas on the English page, they had people of different ethnicities. There were more links on the English page than there were on the Spanish page. And then the discrepancy in explaining symptoms was different too, both for Spanish and English, actually. So on the Spanish page, sometimes they had more symptoms than they had on the English page. And on the English page, sometimes they had more, what's it called? They had more explanation in the actual paragraph than they did on the Spanish page. And another discrepancy was on the English page, or actually I should have said this more for the advertisements, it's kind of a combination. When they were discussing a strain of gonorrhea, they were talking about, they had a picture actually of the strain, whereas on the Spanish page they didn't have that. I thought that was interesting. Everything else was the same in terms of pictures, but they didn't have the strain, and it comes from the same strain in any language, so they did not have that. Here is my reference for the STDs page on the CDC website. Obviously, I can't have a reference for the hospital, but I work at Chandler Regional, and that's where the interpretation was taking place. Hope you all enjoyed my presentation, and good luck to you in the rest of the class.